Chronic kidney disease is a global health crisis, affecting millions worldwide. It's often called a silent killer because early stages may not show clear symptoms. Kidney disease affects the kidneys, the body's natural filters. When kidneys are damaged, they can't perform their functions effectively, leading to a buildup of toxins. Understanding kidney disease, its causes and treatments is crucial for both patients and their loved ones. We'll discuss the importance of lifestyle modifications, the emotional impact of the disease, and the power of support systems. We aim to empower patients and their families with knowledge, hope, and the tools to navigate the challenges of kidney disease. Our kidneys, two bean-shaped organs located near the middle of the back, are intricate filtration systems. Each day, the kidneys filter about 150 quarts of blood, removing waste products and excess fluid. Beyond waste removal, kidneys regulate blood pressure, red blood cell production, and vitamin D activation. Kidney disease disrupts this delicate balance, impairing kidney function. Diabetes and high blood pressure are the leading causes of kidney disease. These conditions damage the tiny filtering units within the kidneys called nephrons. As kidney function declines, waste products accumulate in the bloodstream, leading to various symptoms. Early detection and treatment are essential for slowing disease progression and preserving kidney function.
Treating kidney disease often involves a multi-pronged approach, tailored to the individual patient's needs and disease stage. Medications play a vital role in managing kidney disease, including drugs that lower blood pressure and control blood sugar. Regular monitoring of kidney function through blood and urine tests is crucial. Dialysis becomes necessary when kidney function declines significantly, involving filtering the blood externally. There are two main types of dialysis: hemodialysis and peritoneal dialysis. Kidney transplantation offers a potential cure for end-stage renal disease, involving surgically implanting a healthy kidney. Transplantation can significantly improve quality of life and increase life expectancy. However, it's a complex procedure with lifelong immunosuppressive medication required to prevent organ rejection.
Beyond medication, the power of lifestyle and diet. Making healthy lifestyle choices can slow disease progression, improve overall health, and enhance quality of life. A renal-friendly diet focuses on limiting certain nutrients that can burden the kidneys, such as protein, phosphorus, potassium, and sodium. Working with a registered dietitian can help individuals develop a personalized meal plan. Regular physical activity is beneficial for overall health and can help manage kidney disease. Exercise helps control blood pressure, improve blood sugar levels, and maintain a healthy weight. Other lifestyle modifications include quitting smoking, limiting alcohol consumption, and getting enough sleep. Adequate sleep is essential for overall health and well-being.
A diagnosis of kidney disease can be overwhelming, both for patients and their loved ones. The emotional toll of the disease is significant.
Seeking emotional support is crucial for navigating the challenges of kidney disease. Support groups, both in person and online, offer a safe space to share experiences and find strength in community.
Kidney transplantation offers a beacon of hope for many patients with end-stage renal disease. Receiving a new kidney can be transformative, improving quality of life and increasing life expectancy. However, the transplant journey involves major surgery, lifelong immunosuppressive medication, and the emotional roller coaster of waiting for a donor organ. Seeking professional counseling, practicing stress-reducing techniques, and maintaining a positive outlook can help navigate the challenges.
Living fully with kidney disease, a testament to resilience. Living with kidney disease requires resilience, adaptability, and a positive outlook. With proper management, individuals with kidney disease can lead full and meaningful lives. Advances in medical technology and treatment approaches have significantly improved the outlook for kidney disease patients. Beyond medical advancements, the human spirit shines through in the countless stories of individuals thriving with kidney disease. They are athletes, artists, entrepreneurs, and community leaders, proving that a fulfilling life is possible despite the challenges. Their stories inspire hope and remind us that resilience and determination can overcome adversity. It's about finding strength in adversity, celebrating small victories, and cherishing the moments that matter most.
The importance of early detection and proactive management. Kidney disease is often called a silent killer because early stages may not present noticeable symptoms. This underscores the importance of early detection through regular checkups and screenings, especially for individuals at higher risk. Early diagnosis allows for timely intervention, slowing disease progression and preventing complications. Proactive management is key to living well with kidney disease. This involves working closely with healthcare professionals, adhering to medication regimens, adopting a kidney-friendly diet, and incorporating regular physical activity. Understanding kidney disease empowers individuals to make informed decisions about their health. Together we can raise awareness, promote kidney health, and empower individuals to live their lives to the fullest.